Hey guys, Gretchen Zablocki here for our Wellness Wednesday. Today we're at HealthStar with Dr. Wetmore, and we're going to talk a little bit about physical medicine and also low back pain. So Dr. Wetmore, tell us, what is physical medicine?
Sure. Well, it's one of the less known specialties out there, and it kind of started a long time ago in the early 1900s. After World War I, people were surviving their injuries rather than succumbing to them, usually men in the Army, and they were returning home with life-changing injuries. They weren't dying like people used to do in the Civil War.
Yeah.
And so the question in society began how can we help these people to function with their current injury? Also around this time there was a lot of polio going around, and that ended up with a lot of people with paralyzed limbs. And there were also a large group of people that decided that it would be beneficial to use physical things to treat ailments like sunshine, air, exercise, electricity, even cold and heat. And these various groups of physicians came together in the early to late 1940s to form physical medicine and rehabilitation around the core principles of helping people to restore function who've had major injuries, and then treating a wide variety of nerve, bone, and muscle ailments.
Okay, so now let me ask you, when you say physical medicine and rehab, how does that differ from physical therapy?
Sure. Well, a physical medicine physician is a residency trained physician.
Okay.
And so we diagnose and treat a wide variety of physical ailments. I prescribe a lot of physical therapy just because a lot of times people with physical complaints need physical therapy to address that.
Right.
Which is something that's very in line with my training. Use physical things to improve physical symptoms.
Yeah. What are some of the most common symptoms and problems that you treat in physical medicine?
Oh, sure. Well, just about anything that hurts.
Okay.
That's a pretty big list.
Yeah.
Shoulder pain, hip and knee pain, and arthritis in those joints. Low back pain, neck pain. You could make a song out of it if you tried hard enough. But also a lot of different types of neurological concerns, peripheral neurological diseases, carpal tunnel syndrome, diabetic neuropathy.
Okay.
And also extremity spasticity. I do a lot of Botox injections for neck muscle tightness and extremity spasticity after a stroke, as well as migraine headaches.
Okay. So our blog this month on HealthStar was on low back pain. What are some of the common causes for low back pain?
Sure. Well, low back pain can be a very frustrating thing because there are a lot of common causes.
Yeah.
And there are a lot of structures in the back that can cause pain. You can have, and this is going to be a little bit of medicalese, which I apologize for, but you can have facet joint arthritis, you can have degenerative joint disease. Each one of those can get you into pain. You can have compression of neurological structures in the back, like your nerve roots, and that can cause pain. You could also have musculoskeletal pain in the muscles of the back.
Yeah.
So you can also have pain in the musculature of the buttock that can be interpreted as low back pain, rightly so. So the challenge lies in trying to figure out what structure is causing the pain, and can I quit it to stop, get to quit hurting with physical therapy or bracing or oral medications or injections.
Okay. So with all those different common causes, what are some of the most common tests or scans or things like that are used to figure out what's going on?
Sure. X-rays of the lumbar spine are very common and can show facet arthritis. They can also show, the height of your disc spaces. They are a little limited because they can only see bone, which is usually where an MRI comes in.
Okay.
It can image things in the back that aren't bone. And there's a lot of important ones, ligaments and neurological structures, nerve roots, and things that are important to get a picture of, particularly if you're going to go for an epidural or some other kind of X-ray guided back injection.
Yeah.
You want to know what your target is before you order that procedure, before you have it done.
Yeah.
So as far as imaging is concerned, MRIs and X-rays, occasional CTs, although I really prefer not to because that's a lot of radiation.
Okay.
Yep.
Okay. And then what are your most common treatments for low back pain?
Well, physical therapy can be helpful if you have a muscular type of back pain due to a muscular injury or a musculoskeletal pain. Oftentimes, if that doesn't improve, you can do trigger point injections into the muscles that hurt. That's just usually a steroid. That's not a guided injection. It's just an injection that anyone can do in the office.
Okay.
And you can even do X-ray guided or fluoroscopically guided epidural injections, or even facet injections. Those are also fluoroscopically guided.
Okay. And you do those as well?
I don't do those,
okay.
no, but I refer a lot of those
okay.
To appropriate physicians in the
okay.
area that perform those. I do a lot of joint injections, ultrasound guided joint injections for joint arthritis, but not spine injections.
Okay. And then, are you currently accepting new patients?
Yes.
Do patients have to have a referral from their primary to come see you?
Usually insurance will require a referral form to be sent from a primary care physician.
Okay.
But yeah, I take all insurances.
Okay. And again, we talked about low back pain today, but you treat pretty much
just about anything that hurts.
Yeah. All right. Well, anything else that you want our patients or our consumers to know? Anything else you want the community to know about you and what you have to offer here at HealthStar?
No, not really. I just enjoyed this opportunity to talk more about low back pain and my specialty and what it is, because it's not a very common one, and I often have to explain to people what it is, because it's not family practice, it's not general surgery, it's not one of those specialties that people generally say, oh, I know what that is. So.
Yeah. Well, again, so as Dr. Wetmore was saying, if you guys are suffering from any pain anywhere in the body and are just needing to figure out how to function better in your daily life, talk to your primary care physician, get a referral, and come and see Dr. Wetmore at HealthStar. Thank you. We hope you guys have a great Wellness Wednesday.
Thanks.